Hi, this is Dr. Gayathri, consultant child psychiatrist at Maarga Mind Care. Today I wanted to speak a little about mental health in children and specifically in teenagers and adolescents. So a CDC report which was conducted in about 2018 to 20 reported that the prevalence of behavioral issues, emotional problems, anxiety, ADHD was about 8 to 10% in children, whereas the prevalence of major depressive disorder in adolescents was nearly 30 to 40%. Now when we look at the big picture, right, this is a very alarming statistic which we definitely need to address. As parents, I would urge that every parent looks for these signs which we call as red flag signs in their children, such as any change in behavior, any recent change in behavior, such as not willing to go out and mingle with peers, play as before, reduced involvement in activities which they used to enjoy doing before. Maybe your child would have liked to watch movies, maybe the child would have loved to go play a game with their friends, and they don't seem to go for it, or they don't seem to enjoy it as much as they used to before. If you noticed any change in their sleeping patterns, are they refusing food more? Have they become extremely conscious about what they eat or how much they eat and how they're being perceived by someone else, which relates to body image issues? Is there extreme tantrums being thrown, as opposed to the usual adamancy which is generally seen, such as teenage rebellion? But some things are crossing a line perhaps. They are shouting more than before, they're using words they've never used before. Are they being physical? Are they expressing their anger physically in aggression? So these are all things we will need to look for. Like I had discussed in my previous video, mental health and mental illness presents very differently in adults and children. So in children, there is more of irritability, there is more of avoidance, especially in the teenage years, when they would like to be aloof all the time, where they are shunning society, where they prefer to be kept alone, leave me alone, right? I think that's a very common thing which most households with teenagers face. Giving them privacy and independence, absolutely right, but they also need to know that there are people who can understand what they are going through and are more than willing to lend them a ear, a shoulder to lean on, to talk about what they're going through, right? Because teenage is a very vulnerable age when they have not yet attained the cognitive sophistication of an adult, where they're unable to choose between what is right and wrong, where there are many ways, many chances for them to go astray into substance use as a way of escapism, as a way of coping skills. Or some people may resort to self-harm or even have thoughts about death or suicide because they do not know how to handle what they are facing. So to prevent them from taking these kind of extreme steps, the first thing and the best thing we can do is talk to them, or tell them that we are always there to welcome them, to hear them out and relate to them as much as possible so they don't feel alone in their struggle. If you ever feel that as parents you have some difficulty in relating to the teenagers at home, if you are unable to at times address, or if they don't seem to be willing to come forward and speak to you for any reason, then maybe you can seek professional help. We at Maarga have a child mental health team where I am the child psychiatrist, and we also have a child psychologist who will be able to address the issues, assess the teenager as required, and give any kind of therapeutic help as needed. So please do reach out if you ever feel the need for the same.